Thank you, Minister. Good morning. So 1,420 locally acquired cases yesterday, taking the total number of active COVID cases in our community to 14,410. And again, a very busy and significant day for all of us in the COVID response. In terms of distribution, just over a quarter, 377 of our cases of today's cases are in our western suburbs. Again, across suburbs such as Tarneit, Truganina and Point Cook. And again, we see around a quarter of all of our active cases in those western suburbs at this point in time. Around 4 in 10 of today's cases are in the northern suburbs. So 562 of our cases today in suburbs, again, familiar suburbs such as Craigieburn, Roxburgh Park and Broadmeadows. Around half of all of the cases we have, active cases in Victoria, are currently within those northern suburb LGAs. A quarter of our total cases, both today and overall, are in the southeast and eastern suburbs. 89 of those cases in the eastern suburbs, in places such as Doncaster and Templestowe. And in the southeast, we have 307 cases today across suburbs including Pakenham and Dandenong and Noble Park. We have 80 cases across regional Victoria today, and in total now across regional Victoria, 611 active cases. The most significant of today's cases in regional Vic, including in Greater Shepparton, where we've seen 15 additional cases. Now, 8 of those are household primary close contacts and well isolated under control. 5 are either secondary social close contacts or workplace close contacts, and 2 more are under investigation at this point in time. In Ballarat, we have 8 new cases overnight. 3 of those are household primary close contacts, and again, not of huge concern. 3 are a cluster of disability workers that we've been working with for the last week or so across a number of different facilities, and my thanks to those organisations for their supporting and contact tracing and working with their staff and, of course, their clients. We have 1 case in Ballarat that comes from a party exposure in Point Cook, and we have 1 case that is still being investigated at this point in time. Of course, the good news of today is that Latrobe has came out of lockdown late last night. We do have 8 more cases in the city of Latrobe overnight. However, 4 of those are known household primary close contacts of no huge exposure risk. 2 are from another household that's been part of our ongoing investigations. We're just nailing down their acquisition source, and 2 cases came in late last night, are under investigation this morning, and we'll update that in the CHO release later on this afternoon. I also have to advise there are 4 new cases in Mildura. It's been a while since we've seen positive cases up in our far northwestern corner, but 3 of those are all close contacts to each other with some cross-border associations. The 4th case is under investigation as it came in late last night. And we, of course, continue to support the community in Mildura as we work through those networks. We continue to do a lot of work, particularly across regional Victoria, to support those small clusters we're seeing in a number of our regional locations. And we've got our rapid response testing teams out there across a whole number of locations, including Wangaratta, Traralgon to support the Latrobe Valley, Warrnambool, Kerrang, Warragul, and Ballarat, Ararat, and Bacchus Marsh. And across all those regional locations yesterday, we completed over 1,500 tests. And can I just thank all those regional communities? When we're seeing these positive cases drop, the response is always fantastic. People come out quickly to come forward, get tested, and to really run these outbreaks to ground. And my thanks to them for doing so. And a big shout out to the team at Gippsland Public Health Unit and the wider Latrobe Valley for their work over the last week or so in getting and supporting that emerging cluster in Latrobe and hopefully bringing it completely under control. Of course, yesterday was a huge testing day with over 71,000 tests again. We've continued to expand our testing capacity, and particularly 5 large mass testing sites across outer suburban Melbourne to support that increased testing demand. And we continue to expect to see testing demand continue to remain high as we continue to see caseloads, particularly in the southeast, continue to rise. We now have over 1,000 tests a day being completed at the Melbourne Showgrounds. It's probably the largest site we now have. But also at Coolaroo and at Monash, we're seeing well over 1,000 tests a day. Again, can I thank all those testing teams that are out there to support everybody to go and get tested safely, everybody to get tested swiftly, and getting those results back overwhelmingly by the next day. In terms of rapid antigen testing, and just to add to the Minister's comments, we obviously continue to maintain the PCR test as the backbone of our entire testing network, and we'll continue to ensure that we can deliver well over 70,000 plus tests a day as long as this outbreak and as long as community transmission demands that it's there. But what rapid antigen testing offers us is an additional tool, and particularly to enable individuals and workplaces to bring testing closer to people and to put another layer of control and protection in place. We're investing in over 2 million tests for our health services and our emergency rooms to ensure that when people do come in, we can undertake effective triage. So increasingly you'll see rapid antigen testing being used within our health system, as both we try to protect our health services from further incursion, but also in terms of how we address outbreaks and try to quickly establish where the virus may have run. We will be, and I know many businesses out there have already been using rapid antigen testing, the early adopters out there, but also we get many questions from organisations as they plan their reopening about the role that rapid antigen testing may play. We will be issuing guidance and guidelines and advisory notes over the coming weeks to the wider business community and on our website to guide people about the effective use of using rapid antigen testing in your environment. And this is all part of a shift, an ongoing shift as we move towards opening up around everybody getting ready, both as individuals and as businesses, about how we're going to maintain COVID-safe behaviours when we do see significant community transmission out there across the community. Of course, our strongest tool is vaccination, and we've looked at all the positive cases we've seen in Victoria since the middle of July. We've had now 25,000 total cases, both active cases and, of course, expired cases over the last 3 or 4 months or so. Of those 25,000 cases, 84% of those cases were unvaccinated. So again, we continue to see a much higher attack rate or a much higher risk of becoming positive if you're not vaccinated. 11% of those 25,000 cases had had 1 dose of the vaccine, and only 5% were fully vaccinated. So whilst the vaccine doesn't make you immune from catching COVID, it does massively reduce the risk of you catching COVID or transmitting it on to another person. And of course, it massively reduces your risk of ending up in hospital. I'm also particularly pleased to report, again, we continue to see vaccination numbers rising across all age cohorts in our community and across all geographies across Victoria and Melbourne. But particular shout out, we've now had over 280,000 12 to 17-year-olds, young teenage Victorians already having had their first dose of vaccine. It's phenomenal to have that many young Victorians out there already. I think 3/4 of those aged 16 and 17 have now had their first dose of vaccine, and well over 55%, 56% of those aged 12 to 15. Such an important step forward, particularly as we look forward to starting to get schools opening up again. As the Minister said, we've got a huge focus or walk-up blitz going on with regard to the Moderna vaccine, another mRNA vaccine like Pfizer, that's now freely and easily available across 10 of our sites without advanced booking. So as we stand here today, you can book ahead at any one of our state clinics. You can go to your GP, you can go to community pharmacy and make an appointment to get Pfizer, to get AstraZeneca or to get Moderna, whichever you choose, and you will find appointments within the next few days. There are no long waiting times. But if you don't want to do that, there are now 10 sites where you can walk up to get your Moderna mRNA vaccine. That includes the Melton drive-through, the Sunshine Vaccination Hub, at Jeff's Shed, at the Royal Exhibition Building just down the road, at the Sandown Racecourse Vaccination Centre, at the Frankston Vaccination Hub, at the Plenty Ranges Arts and Convention Centre, Dandenong Palm Plaza, the old Ford factory at Campbellfield, or the brand new La Trobe University site in Bundoora. Any of those 10 sites I've listed, and they're on our website. You can walk up today, tomorrow, Friday, to get your Moderna shot right there, right then, and to get on with your vaccination journey. Finally, we have, of course, a large number of pop-up vaccination sites across, particularly across Melbourne at this point in time. Particularly like to do a shout out for the Oak Park Basketball Stadium at Moreland. That opened up yesterday, and we delivered over 250 vaccines there on the day, and I'm expecting another busy couple of days ahead. We also have the Arthur Wren Public Hall in Casey, again, which opened up yesterday with over 200 doses admitted, and wonderful to see such a broad and diverse range of community members coming forward to get their vaccination done. With that, Obviously, it remains some busy days ahead for us all. Can I please urge everybody, if you're one of the very small minority now that's not had their first dose vaccine, please come forward and get it done. And let's always make sure that those of us who've had our first vaccine, let's get those second shots booked in, and let's get on with this.